Hello, everybody, and welcome. I'm Dr. Liana Lianov, the president and founder of the Global Positive Health Institute, and this is the GPHI's podcast series on positive psychology, positive health in healthcare. And today, I'm very delighted to have with us Dr. Catalina Figueroa, and she's joining us from the Netherlands, but she's actually been very active in the Chilean. She's Chilean, and so she's been a past president of the Chilean Lifestyle Medicine Society, of course, an internist and lifestyle medicine practitioner, and I'm very eager to hear your opinions about lifestyle medicine, positive psychology, and all kinds of things. So welcome.
Thank you, Liana. I'm very pleased to be here. It's an honor to be participating in the podcast. So looking forward to this conversation.
Wonderful. Well, so tell us what grabbed your attention to this field of lifestyle medicine, and if you have a passion around positive psychology, how you first learned about all of this.
Yeah, well, it's funny how like we normally ask people around us, like, how did you go into the path of lifestyle medicine? Because it's really interesting. We are not taught about this in the medical school. And I need to be honest, and I've been hearing this from many people. It was actually kind of a Google search trying to find meaning. Now I recall back, now everything is making sense. But trying to find meaning to the practice I was doing. After I got my title in internal medicine, I moved to work with rural communities in the south of Chile. And then I realized my focus was always on disease, trying to control the chronic diseases, but I was not really doing anything for my patients. I was not doing anything for their health and well-being. The only focus was on getting better numbers, and I needed meaning. So I started searching on Google, and suddenly I saw lifestyle medicine, and I went to the first conference in the US, and then that's how my journey started.
Yes, and it's been wonderful to see the explosion globally of our lifestyle medicine colleagues around the world who have come to the American College of Lifestyle Medicine, and that's how we met. So tell us how you use it now, this healthy lifestyle practices, positive psychology practices in your own life.
Yeah, well, I think in my own life, well, for me, it's very relevant. I always question everything. So to me, it's so relevant to find the why, the reason why I'm like doing everything in my professional life. But in my personal life also, sometimes the reason is just that I want to enjoy, that I want to cultivate meaningful relationships for me. And now, like, if I reflect on the role that positive psychology has on me, now I'm more aware. But I think the promoting my positive relationships with people and finding a meaning for everything that I do, that's really relevant. Yeah.
Well, certainly meaning is a big component of PERMA model, which we talked about on this podcast before. It's this framework of positive psychology that pulls together many elements that really boost our positive emotions and add to our health. So yeah, I can understand that, and many colleagues I talked to, they found this because it was more meaningful to them as they were creating more impact for their patients and for themselves. So thank you for sharing that. And so speaking of, then how do you use it in your clinical practice?
Well, I guess, well, lifestyle medicine is a lot about changing habits, so there's a lot of science explaining what is a healthy habit. And that sounds something very relevant because sometimes we think we know what is healthy, but we don't know. But I think it has a lot more to do with how we change habits, how we promote, how we engage our patients into that change, how they connect into their environment, the family, all the people that's around. And then I think that how we change that, I put a lot of focus in also helping the patient, guiding them to find their reason why they want to do this. if they don't have a reason, and it has to be something different than just saying because I want to improve my health, because that sometimes they don't really understand what that means. But it's like, okay, but why do you want to improve your health? It's more like, why do you want to live a long and fulfilling life? What's there? And so the first step is always that if they are not capable of finding that, it's really hard to change habits. So I think that's how I apply it in general. It's the first step.
Yeah, that's amazing, because I just mentioned before we got started how through this series I'm hearing themes emerge, and one huge theme is that we cannot be successful in our personal health or promoting our patients' health without getting to the why, the inner why, and that's what is the basis of positive psychology. So you affirm that, confirm that, so thank you for that. And of course, this is not easy to do. Do you have any advice for our listeners who are health practitioners about how to do this?
I think it has to be personalized, because when we discuss lifestyle medicine and positive psychology, sometimes it's very general and applicable to anyone, but at the same time we need to personalize it in all ways, in the stage of life and in what's relevant for different persons, different cultures, and different levels of education. To some people, I can have very deep conversations, more elevated, but with some patients it has to be very basic, connect them to someone meaningful in their family, or so. But the point is that I think we need to have more time with our patients. It doesn't have to be a really long time, but if we keep having like 5-10 minutes consultations, we are not connecting. So I think maybe an advice is to take those extra 5 minutes to know who we have in front, and then we can have a better connection, and then from them apply it better. Maybe that can be an advice.
What you're speaking to brings to mind that we actually added a new category in the lifestyle medicine core competencies in the 2022 update called the therapeutic alliance, which is really that heart-to-heart connection between the physician or health provider and the patient. And that's so important in order to move forward. And so you described that very, very well. And so it's a wonderful place to start. So thank you for that. So if our global community that's so passionate about lifestyle medicine and positive psychology, behavior change, if we succeed, what does that future look like? What's your vision of how this would transpire in healthcare and beyond, and self-care and the world? What's our positive driver?
Well, I think medicine until now has been, we call it a healthcare profession, but it's mostly disease based. So we get trained into treating diseases, and the focus is always on disease. And I think, okay, we need to move forward to promoting health and especially well-being. So that has to be the focus. But also, I think it's important that we see it from a more global perspective. So we are part of an environment, a big environment. So all these things about planetary health are relevant because we are interconnected. And then also the focus I'm having now, because I'm studying now here in the Netherlands, like trying to broaden my perspective on health. It's also how we build cities so that we can promote social engaging, so that we can promote contact with nature, so that we create healthier cities that promote well-being. So I think we need to put a lot of focus on that. It's not only about the clinical act of the relationship with the patient, but I think if we see it from that perspective, it's more focused on health and well-being instead of just treating diseases.
Yeah, definitely the environment. So there are all the personal things we can do, but that is impacted by what's in our environment, what's available to us. So it's really stepping back and looking at the whole community. And lifestyle medicine really mostly happens outside of the clinical care anyway, as we well know. And so yes, that's an amazing vision for the future, is if we can step out and be close to nature and have everything accessible to us that will support us with the healthy lifestyle. Yeah.
I think nature is amazing. And yeah, actually you asked me before, but to me, in my personal life, I have a bit of nature every day. That's what keeps me in a positive mood. And and I think we should all go back to that, which is very like an instinct.
And what are some resources that you love, that you turn to find out more and become more of an expert in healthy lifestyles, lifestyle medicine, positive psychology? We're all looking to learn more. Maybe some of our listeners are new, but others may already be familiar, and they're just looking for some different places to get more information and more inspiration as well.
Yeah, true. Well, I think the American College of Lifestyle Medicine has been very, I don't know, like a pioneer in this field. So there are lots of resources there, and I think that's really amazing. But also, since this movement is growing, and as I said before, this has to be personalized. So many of the things there are not very applicable, for example, for the Chilean reality. So it's really nice that we can refer people to their local societies. And let's say in Chile, we have this growing community in lifestyle medicine, and there's a lot of people there doing different things and related to our culture. So it's always nice to have that, and we have kind of a network. And in lifestyle medicine, you cannot be an expert in everything. Some are more into one pillar, more into nutrition and other things. So I think it's important to have that community and know who to refer to. So I think that's nice. And then sometimes, yeah, there are very nice books and you get like good inspiration, and there's a lot out there. But I think local societies are doing a great job.
Yeah, that's a good plug for our local societies, not only in different countries, but also here in the US, we're starting this evolution to regional groupings of practitioners as well. So yeah, and so yeah, locality environment makes a difference. We all have some slightly different needs sometimes based on what's available to us, and we can support each other through our professional societies. So thank you for that. And we keep these podcasts pretty short, so we're pretty much at the end of our time. What last minute advice do you have for us? What is one idea you would like the listeners to walk away with after listening to you?
It's a hard question. But I think, well, as I said before, we are responsible as doctors, physicians, healthcare professionals in general, to promote health and well-being in all our patients, regardless of the field we are working on. Sometimes this doesn't have to be only for lifestyle medicine practitioners. It has to be for all different types of specialties. We need to start incorporating that, because all our patients have a network. They all have relationships that impact care. They all have a life full of context. They all need to feel better. So to reduce the pain, to control better a disease. So this is important. This is relevant for all of us. And I think we have this responsibility of applying these concepts and really work towards medicine being the science of health, or the practice of health. And I think that should be the message, or that would be the message that I would like to spread.
Well, thank you. Thank you for that. And thank you for joining us and sharing a few words of wisdom with us, all the way from Netherlands, but with the Chilean perspective, and wishing you well. This was Dr. Catalina Figueroa, who joined us today. And thank you to our audience, our GPHI podcast listeners, for joining us. And we hope to see you again at another one of these podcasts. And in the meantime, be safe, happy, well, and till next time. Bye-bye, everybody.
Bye. Thank you, Liana.